Friday, everyone, and thank you for joining us on Fried Okra, the public education podcast for Oklahomans. I'm Carrie Coppernall-Jacobs with the Oklahoma Education Association.
And I'm Alicia Priest, president of the OEA. Fried Okra is a weekly podcast where we get together to talk about public education issues in Oklahoma. We hope that you'll join us every week.
Well, we are very excited about our guest today. We have Dr. Donna Tyungu, who is a pediatric infectious disease specialist at OU. How are you today, Donna?
I'm doing great.
Great. Let's wait. Oh, there you are. And normally we're on a podcast, but today we're on video. So hello, everybody, for who's used to seeing us or listening to us only.
This is what we look like.
This is what we look like. Tell us a little bit about yourself and your background.
So before we start, can I just know why fried okra?
Okay. Yeah. So fried it's Friday Education Oklahoma. So FRI.
I love it. Okay.
Okay. Okra. Fried okra is probably the state fried vegetable, something.
If it's not, it should be, and I bet we know some lawmakers who can make that happen.
Let's make it happen. So yeah.
All right. So a little bit about me. So my name is Donna Tyungu Vincent. My husband's last name is Vincent. I was born and raised in Stillwater, Oklahoma. I did all of my education in Stillwater. Went to Stillwater High School. Then went off to college at Indiana and did medical school at Michigan State. I did Pediatric Infectious Diseases Fellowship at New York University and then the University of Texas in Houston. And now I'm here. And I am the chair of infection control for the Children's Hospital at OU Health Sciences Center. And I am also Pediatric Infectious Diseases faculty, which has been very interesting. It has been a very interesting 2020 for everyone, I'm sure, but especially for myself, because I've heard a lot about pandemic viruses. So it's interesting to be in this position living through it. So,
yeah. Well, so let's talk. That's what we wanted to talk to you about today. So let's talk about that. 2020 has been eventful, to say the least. When you think about schools restarting and schools as an environment, what are things that, like, what comes to mind for you? Like, what are things that you think that schools need to reopen safely? What's a timeline, or like what's an environmental situation that you would think of that needs to be in place for kids and adults to be safe?
Yeah, I mean, I think that question starts with the community, really. The countries that have reopened safely, and it has been done, there's many countries that have reopened schools safely, and some countries reopened schools and actually had a decline in their cases after reopening.
Wow.
And not necessarily because schools reopened, but because they were so cautious and opened carefully. So the first thing that you would want to see for schools to reopen safely would be the community spread of the virus kind of on the downtrend and under control. Because then you would know that there's not overwhelming amounts of virus within the community that will be passed around once people get into the school setting. So that's the first part, is having, your community spread of the virus under control. And then the second part would be, things you can do on the ground to make things as safe as possible for students and for teachers, like certain PPE and making sure, some of the things people have been doing internationally is having students actually wipe down their own desks multiple times a day and do, so the teacher will walk through the classroom and spray the cleanser or whatever it is onto a desk, and then the students will take that opportunity to wipe down their own desk. And then, obviously a huge emphasis on hand washing and maybe hand washing breaks. There's also been discussion about children being in certain bubbles or pods, so that if an infection were to outbreak, there would be very easy contact tracing to everyone who was involved in that situation. So there's a lot of different ways that, schools could kind of set it up and try to open as safely as possible, with the caveat and the understanding that there will probably be outbreaks. It is a respiratory viral infection, and for me to come out and say, this is going to be super safe and there's never going to be any infection that pops out from all of this, it's just not, that would be disingenuous. And I think that would be something we have to really understand going into it.
So to backtrack about community, the community spread, the load in the community, how is it looking? How do you describe it right now in Oklahoma? I know how I describe it as a layperson, but like you as an expert in infectious.
How do you describe it as a layperson?
I don't think I should use that terminology right now. It probably isn't family friendly.
Oh. So we might have similar description. No, just kidding.
Describe it as not great right now.
And so obviously we discussed like the last 3 days of data. We don't really know. The health department says they're having an error in reporting the data. So prior to those 3 days, we had very kind of alarming increases in our numbers.
Yeah.
And so yeah. That's, alarming. So if we want to compare us to other states like Florida or Texas, we are not anywhere near that level of alarm and concern in the community. But we are at a point where I think we would expect infections to occur.
Yeah.
Luckily, though, Oklahoma City now has a masking mandate. We know Stillwater, Oklahoma City, Norman, Tulsa. Mm-hmm. So those, I would expect the viral spread in those communities to actually decline.
So one of the things that the OEA has asked is that anyone coming into a school should wear a mask. Is that, is that, medically sound to help?
Oh, absolutely. Absolutely. So what we do know about the virus is that it spreads much, much more easily indoors. So if there are people, coming from the community that we know has increasing levels of viral spread, if they're coming indoors, they should have a mask on their face. Absolutely.
So speaking of masks, let's talk about some myths that might be out there. One that we've heard is that as soon as you start wearing a mask, then mold is going to start growing and get into your lungs.
In between the layers, and you'll be breathing mold, and that is even worse for you than getting COVID.
No, that's false. If anyone has ever had bread in their home and watched how long it actually takes for mold to develop on a loaf of bread, it might be a similar situation to the mask. It would take a very long period of time, days, for mold to actually develop on the fabric. And the recommendation after you have worn a mask throughout the day is to wash it at the end of the day. And at the very, very least, it should be hung in UV radiation, like in the sunlight, which would also prevent mold from growing on it too. So that one's false. What's the next one?
Testing 101. Doctor.
There's one that I've heard about CO2 retention.
Yes.
Yeah.
That's false. We wear We wear our N95 masks all day. This is one of our research masks. We are also researching masks, but this is one of our research. This is a KN95. I literally wear this all day long, except for when I'm in my office all by myself, with an over mask, and I do perfectly fine. And then this has been debunked a lot by medical people getting on YouTube and things like that. And they'll put like a pulse oximeter on their finger and just wear it all day long and show the pulse ox. You know, I don't know if you guys have seen those, but people's oxygen levels in a cloth mask or a simple surgical mask, there's absolutely no concern for CO2 retention in that situation.
So our doctors who are doing long-time surgeries that take, 8, 10, 12 hours, they're not losing brain cells because they're wearing a mask during the surgery. Is that?
That's absolutely right. And in the era of COVID, a lot of those surgeries are happening now. Previously, it was just like the simple surgical mask for the whole procedure, but now, to be extra careful, a lot of those surgeries are happening with N95s on. So we're all fine. We're all still here.
Thank you.
So one of the I don't know if it's really a myth so much as like a perception is people have said, oh, well, like kids aren't going to get it, or it doesn't make them as sick, or it's not really a problem for kids. Can you talk about that perception? Because I mean, kids can still get it, and frighteningly, children have died from it. I mean, it's scary. Like, can you talk about that perception?
Yeah. So the overwhelming majority of children who actually get this virus will do relatively well, and that has been shown, across the world. If children get COVID-19, their bodies, for some reason, handle it very similarly to other respiratory infections. And if you compare COVID-19 with flu symptoms in children, it seems that children even have less actual symptoms from COVID-19, which is interesting. That being said, it's not every single child. Obviously, we just had our first child in Oklahoma pass away from this virus. So it is something to take very seriously. And even if a child doesn't have symptoms that are harming them, we don't yet know the long-term effects of having been infected with COVID-19 for even children. Obviously, this virus was just born in December, right? And so we don't know the long-term effects of having had this virus. And we cannot say that a child who has the virus isn't giving it to their mother, isn't giving it to their grandmother, isn't giving it to someone else, even though they're asymptomatic. Yeah, that's why masks are so important.
And that's a concern. Alicia, I know that you've heard it from many members of that the spread issue.
Right. So if educators, teachers, support professionals are going to be in school buildings with kids who could be asymptomatic but have COVID, the possibility of spread is alarming for many of our educators. What I think 50+% are over the age of 50, and 30% have underlying health conditions, whether it's past bouts of cancer, current bouts of cancer, diabetes, asthma. And so it's very concerning to our educators to be coming back to school without the PPE and the cleaning supplies needed to have face-to-face education.
Yeah, absolutely. I completely understand. And this is really personal to me. My mother-in-law, who I love dearly, is a teacher's aide in Stillwater. And she's 68. And she is insisting on going back to school, even though I'm trying very hard. No, I'm not trying to convince her not to, but she is insisting on going back to school, even though it's a high-risk situation. The only way I would really be okay with her going back in is if she has if the school is agreeing to face masks on the students. Because let me explain face masks. So if nobody's wearing a face mask and one person has COVID, the risk of transmission is about 90%. It's very easy. I mean, it's a very aggressive virus. If two people are both wearing face masks and one person has COVID, the risk of transmission drops all the way down to 1.5%. And if two people are wearing a face mask and they're 6 feet apart, there's no risk of transmission.
Why
Right?
are we not all wearing masks?
Why have we not mandated masks to mitigate the spread?
Well, we all wonder the same question. I think at the beginning of the outbreak, it was very confusing for everyone. So a lot of people, because so much has changed, a lot of people forget what happened at the beginning. We were reusing PPE. Like, I don't know about you guys. Yesterday, my husband and I, we went to Target and I saw a face mask on the ground. And I think I was traumatized because, somebody had used it, come out of Target and just thrown it on the ground. I was traumatized by that because I have been in a situation where we did not have enough supply to guarantee everyone. And so people would be wearing these things for like 2 or 3 weeks because we just had nothing. And so at the beginning, health officials were not advising universal use of face masks. I think that contributed a lot to the confusion. Some of us really thought it was going to have to be necessary, even if it was cloth, because the way coronavirus works is it's spread through droplets and very small aerosol particles. So if you catch the droplets in a face mask, the amount of particle that gets out either goes a tiny bit out to the side or through the back side of the face. So the amount of spread when you're talking to someone is very restricted. Even the medical community at the beginning of all this was divided on whether we should get face masks or not. And it was compounded by the fact that we didn't have any masks, even in the healthcare environment, which was terrifying, with the new virus out there. And so yeah, we know a lot of different things now. The entire medical community, the entire public health community has shifted to explaining how important they are now. We know a lot more than we did before. We don't have the shortage that we had before. And so yeah, at this point, that is a great question. Why aren't they mandated? Why aren't we working together as a community to wear them and it's not forever. It's for a limited period of time till we get it under control and we figure out what to do next.
So you mentioned your mother-in-law. When you think about like your family going back to school, going back either as students or as employees, like, how do you feel about that? Like, I know how I feel as a parent, and I'm nervous and scared, and I don't know. How are you feeling about that?
Yeah, so I have mixed feelings because there are countries who've been able to do it very, very successfully. But like I said before, they had very low community spread amongst the actual, in the actual country. Like some countries reopened schools, but they had 120 new cases a day in the country.
Oh,
not in a certain town. Right? Like there's some countries that reopen schools and they had 63 new cases a day. If you have very small numbers, you can contact trace and you can make sure those people stay home and you can make sure nobody else is getting infected. It's a little bit different. Like if you think about Texas, if you're having 10,000 new cases a day, how do you do that? So yeah, I'm a little apprehensive about my own family going back to school. I talk ad nauseum with my sister-in-law about this. My nephews are very adept now at wearing masks in public, and they understand the importance of it. So it really is going to be a community effort. School is a community atmosphere, right? Like everybody's coming together in one location. We really need to get the community on board with helping stomp this virus out. And that's the problem, with public health and our constitutional rights all jumbled into one, because public health is really, we all work together and it's not really about your constitutional right, and it's not about whether you want to or like to wear a mask or whatever. It's about we have to get the virus under control.
Yeah.
It's about community. It's about caring.
It's about community.
And,
absolutely.
And wanting to be safe and healthy for everyone. No one is expendable.
Right.
No one is expendable. Absolutely. So, I mean, yeah, I'll just leave it at that. I completely agree. I don't think we should lose one single teacher or one single student at all.
What message would you have for parents or caregivers, grandparents who are wrestling with this right now? What is the message you have for those folks?
I understand that it's anxiety provoking, and honestly, we're all going through it together. The things that you can do as a parent or a grandparent it's all the same things we've all been telling everyone. Hand washing for 20 seconds. If you can't hand wash at the time, hand sanitizing, keeping a social distance, and wearing masks in public. So, I mean, when is school scheduled to start? August 10th? Is that right?
Some a little bit earlier for teachers to come back, but yeah, anywhere in the next 2.5 weeks and beyond.
So what I would be telling parents right now is to really get their children trained on how to properly wear a mask, and really working on not touching their face, because that's one of the issues is if you have a mask on that's not comfortable, kids are going to be adjusting it, and that is a concern. You don't want hands near the face too much. And so if we had low enough community spread, we wouldn't even have to consider discussing masks on super young children, because it might be a safer thing to allow our younger people to come back without covering their face. But at this point, I don't know that we can say that we can safely do that.
Yeah. Well, go ahead, Alicia. Go ahead.
So for teachers coming back to the classroom, what would you say to them?
I would want let me specifically speak to my mother-in-law's situation. I want her to have a face shield, to have a mask on. I want her to have enough hand sanitizer and, everything she needs to be able to protect herself throughout the day. And, for teachers, it's going to be all of the things we've discussed as well. I mean, the way to protect yourself from this environment, from this virus, is distancing, social distancing, masking, hand washing. So if there's a way to work with the powers that be to really understand the safety plan of going back to school, that's really important. I hope that they are doing that. Is that being done?
Pushing.
Okay.
Pushing.
And then, going back to school with full classrooms may not be the best way to start until we get everything under control. So allowing some families to continue virtual learning, if that's what they choose to do, then I think that's a smart decision, because if you have less people physically in school, then you can separate. You can move desks apart more, and you can have further distance from the teacher. So those are a few things, but I work in a children's hospital. Essentially, we're not a school, but we have lots and lots of children around. And the ways we stay safe are every single person that walks in the door, no matter who you are, has a mask on at all times. Like we started that many months ago, like before we were even talking about it, because hospitals across the country were putting masks. It was mandatory masking in hospitals. So even before we had the mask mandate in Oklahoma City, I always felt safest at work. I felt safer at work than I felt like going to get groceries.
Yeah. I was, as you were talking about that, one of my daughters had an appointment at Children's last week.
Oh,
and,
yeah?
and I felt so anxious before going because I was just like, I don't want to be in a hospital. Like, that is scary to me right now with everything happening. And I felt so safe there.
Oh, yeah. Thank you for saying that.
I was so grateful. I mean, really, because everything was readily available. Like, you could use hand sanitizer a million places. Everyone was wearing masks there. I mean, it really like cut down on that nervousness.
Yeah. I mean, I'm really happy that you said that. Like, I think that's really important for everyone to understand that we have really worked hard to make a safe environment. And so, yeah, people shouldn't, and you know, that brings me to another thought about like vaccines. And people should really call their pediatricians, because when I took my son to the pediatrician, it was the same. I'm a pediatrician. I'm a pediatric infectious disease, but I was still nervous to take him to get his updated vaccines because I didn't know how that office was planning to keep him safe. And they did a great job. They actually had us wait in the car because they didn't want anyone in the waiting room. And, you know, so people should make sure to continue getting their children their vaccines. It's probably a very safe environment. And I know that's probably in the last few months been something that people have maybe paused or pushed off. Like, I keep pushing off my dentist appointment because I don't know how that's safe right now, even though they assure me it is.
But this is the time of year when people are thinking about those kinds of things, but back to school with physicals for sports and vaccines before the start of school and all that. People are thinking about that kind of stuff. And I'm sure you're right that people might be feeling a little anxious about, ooh, do we really want to go into the doctor's office, or do we?
Yeah, but I'm telling you, like, it is, I mean, you can call ahead and ask about all of that's the other thing I've been telling parents to do, is make sure to have the discussion with the school board. What are the safety measures in place? How do we know that everybody's going to be safe? And you can do the same thing with the pediatrician to make sure it is safe to go get your vaccines.
Yes, never wrong to advocate for your kid. That's all I'm saying.
That's absolutely right. And to advocate for yourself and your colleagues.
Yes.
And in schools, I think that we should, at the minimum, strive to be what our hospitals are doing to keep kids safe.
Yeah.
And, you know, you so eloquently went through all of that. So thank you so much.
Well, we are very grateful for you, Dr. Tyungu, and your colleagues and everything that you guys are doing. And we thank you for taking the time to visit with us today and talk to our members. We appreciate it very much.
You guys were fun. It was nice to meet you guys.
Yeah, come back again and chat with us sometime.
Anytime.
Yes, in happier times.
Yeah.
They will come. Excellent. Thank you.